Millions of students sit for NEET every year, and for the vast majority, the results bring a crushing sense of failure. The cultural expectation is heavy. If you miss the cutoff, your dream of working in medicine is over. That feeling of defeat comes from a massive blind spot. The bottleneck isn't a lack of medical careers. This keeps you at the center of healthcare without the NEET prerequisite. We are going to break down 14 specific allied health, pharmacy, and nursing courses that you can enter directly without a NEET score. Selecting one of these paths requires a strict balancing act. You have to weigh the length of study and the prestige of the title against immediate employability and how narrow your daily focus will be. This table compares the traditional MBBS path against the allied health track. Notice the difference in the time it takes to get your first paycheck, the flexibility for global mobility, and the predictability of your work-life balance. These 14 courses are booming, independent career tracks. Finding the right one comes down to matching the specific demands of the course to your personal constraints and goals. Let's look at the first set of options. This is for students who want clinical authority, the ability to practice independently, and professional prestige, all without facing the NEET bottleneck. The PharmD, or Doctor of Pharmacy, is a rigorous 6-year pathway. The curriculum is deeply focused on clinical pharmacy, direct patient care, and drug safety protocols. Completing those 6 years grants you the doctor title. In a hospital environment, clinical pharmacists command serious respect and hold significant authority over patient treatment plans. Next up, there is physiotherapy, or BPT. Over 4.5 years, you train extensively in sports rehabilitation, orthopedics, and neurology. The distinct long-term advantage of a BPT degree is independence. You have the direct ability to open your own private clinic and build a self-sustaining practice outside the hospital system. The trade-off of this long game is time. You secure high clinical authority and prestige, but you delay your entry into the workforce and your first paycheck by several years compared to shorter degrees. If your priority is maximizing your earning potential and you can handle a high-stress critical care environment, you need to look at the technology-driven specialties. BSc Perfusion Technology puts you directly in the operating theater. You carry the immense responsibility of operating the heart-lung machine, actively keeping patients alive while surgeons operate on the heart. BSc Cardiac Technology keeps you in similar high-stakes environments, focusing on the active management of cath labs, ECGs, and bustling cardiology departments. BSc Radiology and Imaging Technology shifts the focus to diagnostics. You are responsible for operating and interpreting data from complex machinery like MRIs and CT scans. This chart maps study input against salary. Perfusion, cardiac, and radiology cluster at the peak of the y-axis for earning potential. But look at the x-axis. These demand intense, specific study.
They are rigid niches. A perfusionist masters the heart-lung machine, but cannot pivot. The payoff for enduring these high-stress surgical and diagnostic environments is the ability to command the highest salaries available within the hospital ecosystem. The third group of options is for the global climber. If your primary goal is leveraging your education as a direct passport to settle abroad, your strategy changes entirely. This map highlights post-2020 international hiring data. You clearly see high demand radiating from India to North America, Europe, and the Middle East. A 4-year BSc nursing degree places you directly in this global pipeline, leading to ICU roles with consistent international stability. Biotechnology offers another highly exportable skill set. The coursework focuses heavily on research, the pharmaceutical industry, applied genetics, and AI in healthcare. Because of that focus, biotechnology serves as the premier launching pad for students planning to pursue advanced master's degrees or secure funded research roles in foreign universities. You secure high international mobility and foreign salaries with these paths, but you must commit. You're signing up for either physically taxing direct patient care and nursing, or mandatory higher education and research in biotech. Our final scenario is for the pragmatic student. If you need to bypass long study periods and secure fast financial independence to support yourself or your family, speed to market is your priority.
A BSc in Medical Laboratory Technology, or MLT, provides a rapid pathway straight into diagnostic labs, pathology centers, and hospital laboratories. Similarly, a BSc in Operation Theater and Anesthesia Technology trains you to provide essential surgical support. The hospital demand for these technicians is exceptionally high, allowing for quick placement. BSc Respiratory Therapy is another rapid entry field. The need for specialists in ventilator and pulmonary care expanded rapidly after the COVID era, and the hiring volume remains strong. This bar chart tracks the time it takes to reach employment. MLT and OT Tech put you in the workforce in 3 to 4 years, contrasting sharply against the 6-year commitment required for a PharmD. These fast-track courses provide immediate financial security and stable hospital jobs. The trade-off is that they generally cap out at moderate salary levels compared to the high-stakes tech specialists. Reading a raw list of 14 courses gives you data, but it doesn't give you direction. The true mechanism for career planning is mapping these options directly to your personal intent. This decision tree organizes your options, starting with your primary goal. For the highest possible salary, follow the route to PharmD, perfusion, or radiology. For global relocation, branch to nursing and biotechnology. And for the fastest job, route to MLT and OT technology. The modern healthcare system operates like a massive machine. While doctors act as the pilots, allied health professionals are the engines that actually make the system run. Strategic pivots to specialized roles allow you to build a high-impact medical career that fits your timeline and your ambition perfectly.